can offer termination if it danger to the woman herself, if the woman will die. For example, what's called ectopic pregnancy, where the baby for normally grown at the womb. If it's not grown at the womb, it they kill the mommy, it they kill the pikin. For terminate the pregnancy, if you not terminate and the baby go die, the woman go die. In the case of incest, waiting for do. In the case of rape, waiting for do. In case of when the baby not formed properly, waiting for do. Where they put the woman in life at risk. So we say we they accommodate all the issues then they and improve on the bill. So for just to let the people not vote for the bill, let them know, again, that is not fair, that is not right. Let we carry on this exchange, so we'll go get input from them.
The program Good Morning Salon Day continues. Still inside the studios, we get the Minister of Health, Dr. Austin Dembi, who can give updates about the Safe Motherhood and Reproductive Health Care Bill. Good morning once more. Welcome to Radio Democracy, sir.
Good morning, Osman. Good morning to you, listeners.
All right. Firstly, start for tell listeners or give a background about the Safe Motherhood and Reproductive Health Care Bill.
Again, I'm really quite sad why the people and they call this Poel Bele Bill. Because this is not a Poel Bele Bill, this is not Kumbra Bill. This is not a bill where they look at the health of the mother. Now we could call it a Safe Motherhood Bill. This country also, we now one of the countries where the whole world they admire. In fact, 3 weeks ago, the one whole Ministry of Health of Liberia, including the minister, the deputy minister, all of them directorate at Nenkayaso. About 3 or 4 weeks ago, the leadership of Burkina Faso and Kaya, at the same time, Botswana Ministry of Health, they're ready for Kaya, so for Kaya, see which we do. So we don't make dramatic progress now. So this country in 2017, I mean, the country with the highest maternal mortality in the world, with 1,300 maternal deaths per 100,000 live births. It means that every year, 70,000 women and they die. This country have been the one country where they say all man afraid for Gebele. We don't change that. We don't reduce the maternal mortality as the fastest drop in the world. We don't reduce them by over 60%. Right now, we get a situation where about 14 to 20% of the deaths then they occur in teenagers. In teenagers mostly because then they try to terminate the pregnancy themselves. As we talk today, right now as how they talk, you worry about patient confidentiality, but I will tell you, right now one major family, they mourn the death of their daughter. We're in a shining beam of the future with their non-loss. So this bill you will get now, a comprehensive bill where they look at safe motherhood. You look at the bill from the standpoint of prevention first. Let me prevent unwanted pregnancies. So you look at education, you look at commodities, then availability, accessibility, affordability, then distribution, guidance around prevention. At the same time, every pregnancy mandatory. We do everything we can for nurture that pregnancy all the way to labor and delivery.
Okay.
And ensure we get effective labor and delivery, and after the delivery, make sure so we get post-delivery care. Now that's the bill they for. The one area where everybody they go on to. Now this one area where every day people in the try for terminate them pregnancy by themselves. And what's happen in that case, then they go, they rupture them womb, then do all kind toxic thing to themselves. By the time they come to hospital, now they die when they come. Either they die or the baby die or they all two die. What in this bill they say, in the exceptional circumstances then, let me get an opportunity for safe termination of pregnancy. And we don't work with the Interreligious Council. We don't get consultations over the past 5 years. I'm really quite surprised with Pastor Kelly Pujong. Maybe not, we don't get engaged yet. But again, this is not a lively debate. We want input. The original bill called for termination of pregnancies as needed. Yeah. But the religious council don't come back and say, hey, we get sensibilities, we get sensitivities where we're very, very particular about. What thing we don't do now for engage with them, say, what's in that sensitivity has? So we go capture that and improve the bill. And there are 5 major areas of import. First, they say, we don't want to let this termination just be general. We say, great, whose area them would are concerned about? And say, well, look, we get areas where we can offer termination if it danger to the woman herself, if the woman would die. For example, what's called ectopic pregnancy, where the baby for normally grown at the womb. If it's not grown at the womb, it they kill the mommy, it they kill the pikin. For terminate the pregnancy, if you not terminate and the baby go die, the woman go die. In the case of incest, waiting for do. In the case of rape, waiting for do. In case of when the baby not formed properly, waiting for do. Where they put the woman in life at risk. So we say we accommodate all the issues in there and improve on the bill. So for just to let the people not vote for the bill, let them know, again, that is not fair, that is not right. Let we carry on this exchange, so we'll go get input from them.
When you start, you mentioned, say, this bill, not a Puel Bele bill.
Yes.
But secondly, you mentioned, say, this is not safe termination. What's not the difference between safe termination and Puel Bele?
So, Puel Bele, now where you get the Bele, you say, I don't want them. You just go no more at random, go say, just remove this Bele for me. Well, again, the law, not the law get now from 1800s. Yeah, no law, not the way they allow that for happen. So you go to hospital and say, no, we can't help you. So what people then they do? Then they go bien, go take all kind medicine, go impact some appalling processes in the way they do for themselves for terminate the pregnancy.
Okay, the quick one. Before we go further, let me clarify certain areas and we just make mention of for the benefit of our listeners and perhaps we not get to knowledge. Any situation there before this bill come into play or it go pass in parliament, any law the way given the permission of medical doctors for terminating pregnancy in a situation where the mama not feel safe or the pikin safe no go.
Well, again, the law within are from 1800s.
A law we give them the permission.
We very ambiguous.
Where they give permission for medical people.
They give permission for medical termination. Yeah, but not ancient law.
So what's different now from that one then this one is for
because
past?
what's happen now, we want to upgrade and modernize the law. Because what's happen right now, this law has to know the advocate. We know they go beg for the people and go terminate them pregnancy. We know they do that. In fact, now the opposite. We want to let people and keep them pregnancy. But what's happen now is when people then go now hospital, for example, in the example working girl, I've been in Shagwema Hospital and Nixon Hospital for 10 years, 30 years ago. When people then go there, the mission, they say, no, we can't do this. If they're against the culture, against the principle. Then they begin and say, okay, well, wait no more, where they go? 1 week later, they don't go do all kinds of things to them body, then they cannot on a stretcher. Then they cannot, that's in the, you get post-abortion care where you authorize for do. Well, post-abortion care in that case, it's not too late. Something they don't rupture the uterus. Something they don't cause permanent damage to themselves. If they survive it, then they get complications for the rest of their life. So the thing this law they do now for modernize that and say, look, we're not the advocate for termination. But in certain circumstances where you need for, it better let you do it safely than you not do it safely. Because if you not do it safely, the consequence is quite appalling. Either you die, or you and the pikin die, or you cause permanent damage. Now that they exist today.
Right.
And the law will try for improve on that. The law, not to abortion law, not to say that all man, anybody we want for go terminate. We don't say, in with discussions with the Interreligious Council, we say, which now not concern them. They don't show we 5 of them concern them. And we don't make sure, say, we amend the bill, we make suggestions for amendment of the bill for reflect them concerningly. As I begin mention, number 1, they say, if the pregnancy good, they at the risk of the woman in life, then they will get safe termination.
Okay.
If it be say the pikin where they form, you not get head, you not get brain, you not get abdomen, you not get all kind of vitals. If you born until they go die in the next few hours, then you can terminate. If it be say you get rape, incest, and forceful penetration, where you get police evidence for, and say we can time. So we don't absorb all the kind of concern. The next thing they say, oh, this not gay before bring gay business kind of side. Well, this not safe motherhood. Okay. Who's saying gay business? Because we put the word gender inside it and say, oh, they're concerned about. So, okay, well, we remove that completely from the bill.
With regard to what you just mentioned, too, there's a particular part of the bill which I don't get off hand right now, but there is a section the way say, my body, my right.
Yes.
So, what's that one they mean? So, the argument, because many people don't misunderstood, perhaps say so this means in LGBTQ.
No, not LGBTQ business. What happened? I mean, waiting they try for doing. One of the concern them, what they try for address and say, waiting at the right of the woman for in pregnancy, and the concern from the religious folks and the cultural folks now, waiting at the husband in right in marriage situation. So what do they say? Well, look, now we don't amend the bill for say, if you get a marriage situation, you get actual consultation between the man and the woman as to what they need for do. What you mean happen in the absence of this, you force the woman for deliver, when you don't get one picking, they even wait till the picking on suckle done, you get another pregnancy, and so somebody they force them for do things. And they say, nobody know, me no one pregnant, so I don't know what you feel like. Yeah? So it's important for law to get woman then right, for let them express how then they feel. And for factor that they say themselves get right. So now a conversation between husband and wife in this case, for law move forward. In another case where, for example, in the case of incest, the daddy impregnate in daughter. So now we say the daddy forget influence for say waiting for happen or waiting not for happen. Again, the picking himself get right. The woman said get right. So again, I think so we try for enforce that in the bill. But if dandy annoys sensibilities, we ready for adjust them, because the principle one say, now say the woman self get right. The woman right get for be factored in. The woman not to commodity for the man for the time in waiting for the waiting not for the. Again, our partnership. So we adjust the language of the bill besides just the woman right, or say in a marriage situation, they also need for consult for an end product where everybody will be happy with.
So what about in case we are in the man and the woman not seems for see one side?
Well, again, now that make counseling a major part of this effort. If you read the bill, like I said, the bill now 360, counseling now an important component of all of this. We did talk. What do we want? I know no make I can sing now so today because what do you want? What do you want? Now for let them baby are them born safely. Yesterday I've been in on a companion radio station. I explained to them. I said the midwife there every day then they sing, oh, I want to be a midwife. Oh, I want to be a midwife. Oh, I want to be a midwife. There is something I want to do. I want to catch more babies. I want to catch more babies. Oh, I want to catch more babies. This is something I want to do. So every day we mission now for let them born safely.
Right.
But if problem there, we whole effort now for counsel, for support. But in extreme cases, we all that fail. The woman said get right. We get for protect that. I think I need our try for it.
Right. Mr. Minister, it's Alex here after I will get for Gona studio because you look a fine voice this morning.
For singing the singer, and they reflect the metro.
Right, okay. When you talk about safe termination, the concern again where they come out from the public get for do it if the facility there for do some of them processes there.
Well, Usman Adan in the bill before. If right now we don't get complete facilities. But if this bill is in place, it will empower we for building institutions, for build the regulatory framework around that, for build the staffing complement, for build the equipment and supplies, and make sure say we deliver safely. In the absence of this, we just wing them. In the absence of this, if somebody come and not get facility, then they go try for do them by themselves. And then they see the consequences.
So listening to you now, perhaps the question will play plenty people in mind how this bill will bring them facility and the money they wait some perhaps after the bill got on pass in Parliament, the money will just then more kickstart them for facility and they for spend the money back.
No, I think the government get commitment to this government. I mean, one of the things that again I don't know, we just underestimate what's not happening in this country. this country, we are a shining example for waiting for do for women's health and women's rights in general. What's happening at this country right now? A revolutionary. And for let we able for support, the government willing for put resources behind them, but without the regulatory framework, without the law for support them, again, we just the wing and no more. We go no more every day. Again, if you don't get this framework, you're able to raise internal resources, you raise external resources, you're able to provide this service here. Because again, you know what you want to do in this country? We want zero preventable maternal deaths. Okay. Zero preventable infant deaths. Now, that's what we go for. Right now, everybody, they clap for we by the reduction we don't do. But we're not satisfied with that. Salon person not satisfied until every belly woman get assurance it go deliver safely for himself and in baby.
Right.
And if we need for terminate in exceptional circumstances, we do it safely so that we save the mama as well.
Before we go for break, Mr. Minister, implementation of some of the bill we Parliament can pass now, it can get a lot of issue. For example, we get the Tobacco and Nicotine, Act we don't in existence. One concern with civil society they raise get for do it the setup of the council. So if Parliament they pass law, the implementation a problem, and the Tobacco Act now another one, then one can add again into the reproductive healthcare bill. Things say go too much.
That's my line can say you could chew gum and walk. We do all of the above. In fact, yesterday now we executive meeting. I mean, the number one thing now they are waiting for do about this tobacco bill. In fact, over the weekend we did a team with His Excellency and one of my colleague minister to say, we're waiting because some people let me sit down some location they talk and say, we're waiting for do about this tobacco bill. Again, now bill we don't pass. Now we do look at effective implementation. We look for resources from government. We look for resources from partners. Again, a comprehensive approach. The board and the council, the board chair will help you for accelerate this. Because it's not deviate from this main.
Yeah, because just an example.
Because
if now governments defend money for implementer, then the safe motherhood bill, safe one can had. That's not my question.
But could really happen at the same time? Again, the importance of the tobacco bill now, nearly every chronic disease associated with tobacco, from high blood pressure to diabetes to all to cancer, all things associated with tobacco. So we did look for the resources, we defend the resources for able for actively implement them because Parliament don't do their own side. Now we own side for implement. But we don't say, hey, let's stop that one day. Let's do reproductive health first. Then we go do child health. No, we did do all of the above. Even when we not get resources.
Okay, don't talk much. But waiting so far, the progress don't make sense. We Parliament, we don't ask them for go and consult. Even at the program, we continue with the discussion so far. I can't again, Mr. Minister. Earlier on the program, we don't talk about the progress so far. I don't make as a result of some amendment. Then I don't propose for make to the bill. We after we Parliament, we don't have to go back and consult. Well, he talk about one thing very important. He say after this bill also come into play, so many facilities in the Canada, the hospitals, we go enhance safe reproductive health care so far. But again, the question where somebody could ask why we wait, why would they wait till a bill come to reality before ever we do things as a nation we will make the hospital be safe for people?
No. I think so. What would they look for? Not so the bill will make improvement kind in general. We get a deliberate effort for improved quality of care. Again, we get several domains around quality of care. First, for example, just for obstetric care, we get what's called basic obstetric care services, BMOC. We get several of them. We get comprehensive obstetric care unit. We're in a high level care. We get quite a few of them. So what you want to do, one continue for expand and make sure say access to them no require much. For example, each and every district get about 2 or 3 CMOC, the comprehensive care, then get about 10, 15 BMOCs, the basic care. We want to expand and make sure say it's available, it's accessible. So none of us say the bill will make we start the process. You get an ongoing process. In fact, a lot of the successes that we'll get now as a result of the safe delivery also, revolve around them BMOC and CMOC, basic care and comprehensive care. We will get one just for consolidating experience.
After the proposed amendment so far, when I don't make to religious body them so far, I mean, we want to for do with so now only terminate in a situation where the mama they on an unsafe situation or the picking self no going no go turn out for be a good some no go get all the parts them we supposed forget all instance whether one they mean rape or papa fall and picking so to speak. This already they are already terminate when the situation has only occur. But again, why paying so much attention into making this building come to reality rather than focusing on the key issues that the hospital, water, light, now common problem. Ambulances and the way perhaps not in certain hospitals and we go on this country. I take a report we health alert do some back. We said in final say certain government hospitals themselves ambulance. Why not they pay attention to most of them common issues and the rather than
Sure. Not that one we there for. Yeah, you'll be surprised for noticing that this country, we get about 1,600 facilities, healthcare facilities. We want by 2030 for expand them to 2,000 facilities. Right now, 85% of the population get access to a mental health facility within a 5-kilometer radius. We want for expand that and shorten the distance even more. Which would you look at? We don't create one of the greatest access you can find anywhere in the region. Which would you work on now? Now for bring quality to that access.
What's not access?
We quality
the access we talk about.
Where you get facility within a 5-kilometer radius. Now that is the basic standard. Yeah. Now 85% of the population get a facility within a 5-kilometer radius. We want for expand Nandi. But what's happening now? We get access now one thing. The next thing behind access now quality. So what we talk about, we get 4 domains of quality. One infrastructure. So you see right now we get about 230 of their facility don't transition from thermal energy to solar energy. We will look at rebuilding the facility themselves, the physical infrastructure, the safety, give them a lick of paint. Second, we will look at staffing and staffing complement. We don't increase the number of nurses and midwives who they train. We improve the quality of their training. We improve on the complexity of the services that we offer. At the same time, we shift to patient-centered care, so that the nurses then get empathy and able to work with the community within staff. We look at supply chain. First thing, once a quarter, now they get supply. Now every quarter, so once a year, now they get supply. Now every quarter, then they supply the free quality healthcare. At the same time, with the complementer, with public-private partnership, with drugs and facilities where you go able for bring the private sector inside for supplement within government they do, and we get drugs as well now all of the facilities. So now work in progress. Then kind dramatic reduction we you see in maternal mortality not by accident. Now by then thing so what they do systematically. So now allow me to tell somebody something in the what they do we're visible to all man. Something anyway invisible. That systems building, we're not visible to all man, 90 responsible for that kind of dramatic drop here on IC. So.
All right. According to religious leaders, them about 9 term or 8 term, governments don't rename past and present government. But still, the religious leader get issue with this bill. Most of them they are against them. What's the problem? They will make you think say the religious leader up till now they are against this bill.
Well, again, I say this na secular country, and I really like the kind of exchange where they go on with the Interreligious Council, because what they say is then get sensibilities, then get some concerns within they raise around the bill. They all don't say this na good bill because na comprehensive bill, but then get some concerns around some aspects of the bill. Like what I say, this bill here focus on prevention, focus on nurturing pregnancy, focus on delivery, focus on post-delivery, and a small component to look at termination. Now that's how they didn't get concerned. So the exchange we'll get with them now, what's not then concern here? And then there is 5 important concerns. One, as I say, now when you go able for terminate the pregnancy. We not agree, but they don't put them proposal forward, we don't consider, we don't make the amendments. The second, now which is the role of consent, would I need for give permission, for example, to minors, Again, the initial say any adult, but now we don't say, no, somebody will get parental authority, now go able for give consent for minors. They say, we doctor them, really perform termination. If you don't agree for them, they get penalties in the old bill. Now they say they're concerned about that. Now we don't remove that. Say it's up to the doctor. If you don't want to do it, if you go against immoral conscience, he allowed for not for dua. So all in concern with the non-raise, we don't include that as amendments to the bill for their consideration. Again, if we agree on the fundamental principle, say, woman not for die, pambele woman business, then again, we get common side for work from. What side the differences in there, we they accommodate and again, I don't want to say throw away all the bill, just we don't want this bill, we don't want this bill. Again, right. If you don't want this bill, that means say you just say anybody who want die, they die.
Okay.
All them picking away again, you don't know, Osman, you don't know how much o'clock then they call me 2 o'clock in the morning, say, do you have one ambulance, one time. Why we for they do that when we get a preventable solution? When we get a safe solution available to it.
Okay.
So again, within this bill they do now for provide all of this for we, and we they make sure say we absorb and listen to and incorporate all of them concerns, but Lord not throw away a good bill because we not read them.
Okay.
Because we not see the comprehensive nature of them.
Continue for the way inside the program. In name now Dr. Austin Demby, Minister of Health, as we there for talk about the reproductive health care bill. We presently get a lot of issues, concern we religious leaders and ordinary people they raise about this particular bill. We'll go for a break. When we come, we continue to look at issues we get to do with this bill.
Please subscribe to my new YouTube channel Don CLIN and hit the notification bell to be notified for new videos.
The program Good Morning Salon, they continue inside the program, we continue to look at more issues we get to do with this bill. And now we go to the president for the Pentecostal Fellowship Salon, Bishop Akintayo Sam Jolly, say if Parliament pass the Safe Motherhood and Reproductive Health Care Bill into law, that will make more women them die in the country. Bishop Akintayo Sam Jolly talk this in our interview with Radio Democracy for sake our engagement with the all for talk about them position on this bill. He talk more to reporter Master Swari inside this interview.
Consider that you get and call that thing called ectopic pregnancy. We all down to say this one the baby not get hope. Okay, so that is not be considered. So we also be qualified that particular point that not be taken out of context. That we say in the event we notice until we're able for prevent. Okay, that is that risky. So if I case with the not know the woman in history, in medical history, say this woman, if you go to full-term pregnancy, then in life you don't ditch that. Then for don't do what they call it now, CS. Okay, for remove the picking alive from about 7 months. And you get all kind of development now with technology and with medical science. Some people go leave, the mama go leave. Then for which till that last crisis moment, then see one get for go. So that now with qualification of what would they say, even want to say in terms of when the mama in life they at risk.
So what are some of the provisions them na the bill we wanna get issue with?
You're beginning from this medical part, for example. Okay, the thing about doctors then that they say get the right to life, right to all the rights from the try forgive. That if their conscience and their faith, their religions, they are not for do abortion, they're not for in any way be penalized or be required for refer the patient by law, okay, to somebody else. Then this thing where the subtle approach, you see, they say law not for be ambiguous, law not for conceal, not for hide things. So in this bill, then carefully try to push abortion as a human right. Abortion is not a human right, it is not accepted globally and not be pushed as that. Also, there's a subtle thing, they don't try firstly in different ways for introduce LGBTQIA, which does continue to expand. Lesbianism, gay, transgender, and all this queer and all of that into it. Okay, now, and even though they say no, don't pull this, but again, there are many more concealed. As you read through the statements, you find this phrase, this one, other status. Now, don't talk about mouth, don't talk about human. These are the other status, and that need to be repeated. So you get phrases like this: reproductive health, okay, and reproductive health care services. Now, that phrase includes abortion. So they say they don't pull this come out, but it's still hide under that. So if you don't know, let's say, oh, okay, now let's say, fine well body business. Issues them about consensus. Okay, that is the woman get right for go well belly in husband or no. Now then don't tweak it and they for say okay, the man gets right for father arm, okay, and then he can involved in decision making. But the way then when you look at it carefully, it actually shows that the husband still not get a right for say to wife say not do abortion. Then we all age 7, age 9, whatever that is, he get right for going for contraceptives. So these are just a few of the multiple things that we hide inside this bill. We could disrupt life, disrupt religion, disrupt tradition, disrupt culture, and it cause many more damage.
What will be the religious and society implication if government pass this bill?
We will get promiscuity, that is uncontrolled, filthy sexual living, okay? Get misconduct with sexual behavior, and it will be rampant in the nation because Oma no say that for the school well belly, okay? We will get homes divided. We will get people drop out of school. We will get and bring in facilities from other we will not get because right now government not get the structure for even give the women proper health care. Okay, go to the report where the Minister of Health, okay, Dr. Dembi, give on maternal mortality issues. Okay, now when you go to the report, you can make it clear that the main thing they cost money for die are because of what's not available, including trained staff. Okay, so when you go this now, women will die more because we still not get trained staff, and with other countries, with obstetricians and gynecologists do they can't in the hands of what they call well-trained or people for trained. I mean, this is going to be devastating. It will get a lot of financial implication. Government's not getting money for finances. It will be for bringing other institutions to establish abortion facilities across the country, and then they will spread them, just kill picking them, and then use them, parts them, possibly, okay, for making money as they happen at some other places them, all right? And so it will bring a cost upon the nation, okay? And then the counseling sessions then, with all these loopholes then, you can be sure say women will be coerced and be misinformed because already as it is, there's a whole of misinformation going on at this stage.
Right, so if government pass this bill into law, we think will be in a position.
If you talk about position, the position will change. If you talk about response, we go look into that response.
All right, so waiting next for Muna on this bill.
As it is right now, we still engage with the legislative committee and those on the government side where they push the bill, and we are troubled by the misinformation where they go out deliberate. These are the dangers because people are being kept back from understanding what's in the issue right now. We want the nation to know what's inside this bill.
Which message will you send out there to government and other stakeholders regarding this bill?
Now people vote them into office to represent the people, okay? And so position for look at what's good for the people. We believe there's a lot of international pressure. We believe that bribery don't go around different places. Okay, and so government for look past those pressures and for investigate whether or not there's bribery. We don't go into different people then for make the nose in time of put government under pressure. Would they say that His Excellency the President, when in Oman look to, we got put in the seat, for examine carefully with position papers there and go through details we don't provide. Listen, and do what's right for the people of the land, not for the pockets of anyone, for please any international body, but do well for the people of the country.
The program Good Morning Salon will continue. Still inside the studios, we get the Minister of Health, Dr. Austin Dembi. You don't get interview. I just listened to the interview from one of the religious leader them. We are the president for the Pentecostal Fellowship, Salon Bishop Akintayo Sam Jolly. Also, made explain to reporter Mastan Soare about the implication if government finally pass this bill. One get for do with pressure from international community. Is it true?
I get tremendous respect for Bishop Sam Jolly, and I don't know how can a public and say negative things about but in this particular case, I think say correct. I mean, wouldn't the international body we care about women in Taiwan and this country past we sole reason for being, as I don't say multiple times, now for save life. And I really, maybe one aspect of the bishop in statement I really agree with. He get concerns. He don't raise the concern. He gets several of the concerns we don't raise. For example, the one where he say doctor them for work based on their conscience. We don't agree with that. We don't incorporate that as an amendment to the bill. The one where he say the issues about marital consent and involvement, we don't agree. We don't incorporate them in the bill. the thing about special circumstances where you get challenges to the health of the mother. We don't agree. We don't incorporate them in we amendment to the bill. So again, I think it's important for the public realize the initial reaction not to the original bill. But again, it will finally the Interreligious Council will also just look at the amendments based on their input. This issue of gay rights or for increased LGBT engagement in that, this has nothing to do with that. What happened, the language of the original bill says gender in a very generic form. If that the insulting or against religious sensibilities, we remove them. We don't remove that from the language. So we not hide anything inside. Again, I want a genuine engagement with the Interreligious Council because honestly, we all get the same ambition. This bill with all of the amendments, we do not add into making an even better bill, make an even stronger bill. Because it factors in all of the concerns.
If you, deny the allegations really come up from the man of God, say this not international interference or whatsoever pressure with the government they face, why now, after this government take about 6 years in power? I want to go for arrive at this point now, say, we take this bill, a low drafted bill like this and take it to Parliament.
You know what you have been on top of at the outset? At the outset. Again, we focus on maternal health. We don't get tremendous success in reducing maternal mortality. Yeah? No doubt about that. Even the church group, everybody agrees, we don't make tremendous progress. The one area we don't left now, we cannot ignore. The one area now where they contribute the highest to maternal mortality, now this particular group of people that when they terminate the pregnancy themselves, we do not get the competencies, they do not get the ability, they do not get the skills. So this law, they ask for increase in that, in termination of pregnancy. They say go terminate pregnancy.
What about the lack of facility in our government hospital? There is some term who be seen on social media who said the woman at one particular village, then put an amok, yes, for go terminate facility. That one they tell you how challenging it is for access facility. Not only for access
go back to that. Go back because what's happening then I'm in Falaba district.
Yes, not only for
access to facility. We get 5 ambulances available
for the entire Falaba district.
The small Falaba, the smallest district in the country, you got 5 ambulances available. You get a network of services. But you know it's not that particular case. You know what's happening? Then get pregnancy. Access the services until the 11th hour. Until the 11th hour. What should they do now? Would they change the engagement around pregnancy around also? Because again, right now, would they look for register every pregnancy? Okay. Pregnancy not to labor and delivery no more. Pregnancy now before, antenatal care, labor and delivery, and post-delivery. So will they change the attitude the way you say, the only time they pay attention are labor and delivery. Okay. Again, what's going to happen when we get complex cases there? Will they alert early? We do not say if you get twins, if you get triplets, if you get quads, we deal with, not to normal pregnancy. We make sure say we know of that in advance. We move you closer to the obstetric care. We then make sure so you link them to an OBGYN. We're not just a regular nurse go able to take care of. Okay. We build that kind of system there. Again, I think say Salon, I need for see what go on.
All right, Mr. Minister, before we go for a break, concern we come out from religious leader them get for do it. Say una one rampant way for Puel Bele. Secondly, you are aware say most of the religious leaders don't begin preach against this bill, not part 3, section 9.2, but now the whole bill that they preach about, they call on the people make them they against this bill.
Again, that unfortunate because again, we the hope say we religious leaders are not sensible leaders, we religious leaders are not caring leaders. Religious leaders and thoughtful leaders. Again, not to for just take random decision making because somebody say this is not Paul Bele bill, then we go begin preach against them. Important now you know the whole issue around this bill and understand them. And I think it's our responsibility for engage. Me the hope say Bishop Sam Jolly and the other colleague them. Nanami will work at that level for let them able for really understand the issues, let them share their concerns then. We incorporate their concerns then and make a stronger and better bill.
You disappoint in some of the religious leaders that we don't start for preaching at the pulpit?
Again, I'm disappointed at that, but again, I think it's our responsibility for work with them, for let we make sure say they get the facts. And basically the preaching when they do it based on facts. It's not based on emotions, it's based on facts. And I think they account and respect the traditional leaders and the religious leaders and say, then are reasonable people them. Yeah? And I think that if we're able for sit down and get this dialogue, you know, we'll say my own way or no way, because again, this is not a theocracy, not a secular state. We get for listen to all parts. Then get for listen to we say get for listen to them. We define common ground.
Okay.
Again, I think say unfortunate if we say be non-beats gone now, go begin talk, but always in there and begin argue and begin insult other people, then values, you know, go fair.
Okay.
And they expect say the religious leader, they said they will get that same kind of sensibility, say we all care for the same thing. This bill no go cause random promiscuity. You know, get no aspect of it. What would they say? You get a problem now. You get a problem, what would they try to solve? You know they create new problems. You get a problem, what would they try to solve? If we not solve this problem now, we know we'll get to that point where we'll say we get zero preventable deaths.
Okay.
We'll get increased preventable deaths. What would they see right now? And this now not to my own problem, not to your own problem. Now we all problem.
Okay.
Because every day we nieces them,
All
we
right.
nephew them, we auntie them, we mama and they die of this. That's why they say right now, one family there, a big family, we grieved, we bereaved because of this year, because they not get services.
We start for take some of the text message, then we'll go we say this first person who will be taking text message this way. There is no safe abortion. Your bill just I take that one day again, Mustafa Bayon, they say there is no safe abortion. Your bill will just give the unqualified medical guys space to do more abortion and get rich by killing innocent children. God will not please with you people.
This one from Jibril Kanu, we say, Mr. Minister, why is the government waiting for the bill to be passed before building the facilities? Why not building and improving the facilities before passing the bill?
This other person, winner Victor Fodi, they say, Mr. Minister, is there any month bracket for the termination of the pregnancy?
And this other one say,
month bracket for the termination of the pregnancy.
And this other one say, what are some of the categories of people that should be?
Okay, this other person of which say abortion. I mean, are you aware of the abortion of the death penalty? He said no more death penalty, and he wants people to kill people.
This other one from Justice Saloni say, if we are really genuine as a country, I do not think the bill will be an issue. Already there is a lot happening behind closed doors because we do not have the necessary structures to address most of the deaths which many of our young girls and women are faced with. So I think this bill is here to address and improve safe space and address the health of women, so the bill is not bad at all.
This other person, they say this bill is not good for our nation. There are many things to address in this country instead.
This one from Lolo, he say, I personally do not support abortion under normal circumstances because, however, we do not always know how pregnancy is, but I think it should be an option available for women.
This other post, they say legalizing abortion divert attention from more pressing issues that could benefit society economically and morally. Why not channel this same energy into creating better health facilities, education system and economic opportunities, addressing the root cause of unwanted pregnancy such as poverty, lack of education and inadequate access to contraception will be more constructive approach.
This other one from Ishmael is say na water in light una no bugi na government hospital them then una one pass bill we go make woman pool belly safe one. Okay, yeah.
This other person, this is Sierra Leone needs to address abortion law. Legality of abortion does not exist with abortion. It only exists in exposure to unsafe practice. We have to protect them. Love means making decisions together and living with the consequences together.
This one say, Mr. Minister, waiting being una sipa this bill will make una de BNM. A come out from Mohammed Nakambia.
This other person, they say, I beg to disagree. People are already benefiting by doing abortions illegally. It is in fact a solution to unsafe practice. If your moral values are against abortion, then you have a right to do it. What you are being stripped of is the discretion as to who should or should not get abortion. Most times people who are vehemently against this issue have had to do it themselves. The only difference is they are not sure. Usman, I think for time another one day I'm your inbox and I will for take now.
And the last one I will take from McTen New England. Say, Mr. Minister, what assurance are you giving the public that abortion will be accepted in tremendous circumstances, including when the life of the mother is at risk, in instance of rape and incest, and the instant? Okay, these are not too clear, Mr. Minister. These are some of the messages then we'll get inside the program this morning.
Just great input from the public. And again, as we see this now listening government, we put forward an initial proposal and up for debate and consultation. And all of the things with the non-raised now valid, important issues where in a lot of cases we don't incorporate in the revised version. So again, the revised version, we don't present this to the Interreligious Council for letting themselves see them and weighing on them, and we wait for a feedback from them, and then we will continue with consultation in public as well as with Parliament. But all in here we don't say really important, valid issues. Again, the main bones of contention with or without this bill, people then they terminate pregnancies. Unfortunately, then they terminate pregnancy in a very unregulated fashion, where they result in high mortality, where they result in complications, where they punish people then for the rest of their life. Waiting this bill they do now for bring sanity to the process. They increase the number of abortions, and they make sure say if and when abortion is required or termination of pregnancy is required, that it is done safely. What do you mean by safety? Again, if you not get this kind of environment for terminate the pregnancy safely, as in the case of incest, rape, or whatever, when the woman in health at risk, you get a situation where people then they do all kinds of practice, and they go to quack them or themselves, they take all kind of medication, where they result in, if they not die, then and then baby go die. Now, down now what they deal with. How to solve that problem? Again, the people in our church, they know they see this every day. The people in our mosque, they know they see this every day. We will sit down at studio, so we know they see this every day. But we in the hospital, we they see this every day. Now, big problem. So what we try for do now for create some laws, we will bring guidance, we go bring regulation, we go bring structure, and make sure say if we need for terminate the pregnancy in special circumstances, and do it safely so that the mother will come out okay. Now that this law they're all about. Again, we not go satisfy if we not get a situation where the mommy is safe. Yeah. And again, all of the concerns that we then give, for example, Bishop Sam Jolibin said the biggest concern is that the doctor then, punish the doctor if they don't want to do it. Well, we don't incorporate that. They say, oh no, this is not gay business, and I know I'm bring come by Saje, by Koni. Absolutely not. We put gender inside it as a generic term, but if that gender they insult people, we don't remove them from the bill. They say marital consent, marital input. We don't say, initially we say the right of the woman. That one they will not go walk away from. The right of the woman is still important. But we say consultation with spouses as an integral part of the family to ensure within decisions after they get made.
Any engagements with tribal aid mandem?
Well, we don't do over the past 5 years, again, which you don't see now, where the bill on go to Parliament, a culmination of a lot of consultations over the past 5 years.
Them in position.
Yeah. Again, them position in a lot of cases now, which you see reflected in the religious council. Again, we try to incorporate all of the concerning. You know, they start with a perfect bill at the outset. You start with a bill based on your consult and your ideas and the circumstances. The consultation, they help you for improve the quality of the bill. So what's me worried about now, where people say, oh, just dismiss the whole bill.
As minister,
Yeah.
you didn't have the country, they
Yes.
see the reaction of people.
Yeah.
You think say this not bill where majority of Sierra Leoneans they want for see?
When people then understand the nature of this, see this bill now comprehensive women's health bill. When they understand, say this bill also, they focus a lot on prevention and ensure say una one belle, no they get belle. That we involve education, involve commodities, make sure say you get the commodities accessible and affordable. They really know say we all process here now for ensure say if the woman get belly, let we encourage them, let we work with them, let we support them, let we make sure you get all immaculate, let we make sure say you get all in mercy, let we make sure say not to 4 antenatal clinic visit, but if we get 8 antenatal clinic visit, every time we can clinic, if you get high blood pressure, we manage them. If you get diabetes, we manage them. If you get other existing conditions, we manage them. All the way to labor and delivery, we make sure so you get skilled birth attendants, including obstetric gynecologists available for ensure safe delivery. And after
Things
delivery,
that people don't know how land they wasting.
well, what's happening? Where people are not making say this is not poor belly bill. They know they see the rest of the bill. Okay. Now we frustrated with. Now the money because again the public need for no say this is not comprehensive bill will cover all the aspects also of the safe motherhood, because at the end of the day, what you want now for let the woman deliver safely.
Okay.
This is not a poor belly bill. This is not Cumbra bill. And again, with the work with again the religious leader them in this country, then get a powerful platform. Then get a powerful platform. People then listen to them, and we respect that. Now make one let them get the facts at their hands, the facts at their fingertips. Not for just go by rumors or what you see. Now make the bill now just very short bill, 18 pages. If you sit down in 30-45 minutes, you will read the whole bill and understand the entirety.
Right.
So again, we'll work with them and ensure say let them understand say all of them views, they get incorporated in the revised version, and we return them back to them for letting them provide input, so we get a much better bill going forward, an improved bill. Again, with the work with Parliament, not a forced Parliament. Parliament not the legislative body in the country. And they make the law, we they execute the law. But what you want to do now for provide all of the facts. So not for tell the MP then just dismiss the bill right off the bat when you know give them the facts and the contents. This now comprehensive women's health bill.
Plenty thank you for joining inside the program this morning. In name now Dr. Austin Demby, in the Minister of Health, assuming there, and we get updates about the safe motherhood and reproductive health care bill, where a lot of people, including religious leaders, them get concerned. But plenty thank you for joining inside the program this morning, sir.
Thank you, sir.
Yes, sir.